My name's Emily Young. I am from Barrington, Rhode Island originally, but I now live in Nashville, Tennessee. And I graduated from the University of Rhode Island College of Pharmacy in 2013. And I chose URI. Originally, it was really mostly sort of a business decision. It was a great value for money for the education that I knew I was going to get. And when I was considering my options and how much student loans I was willing to put up with, it really made sense. And I wasn't willing to sacrifice quality, but I didn't want to come out with a lot of debt. So it really worked out that I fell in love with the college itself once I got there, but it's a great value too.
Yeah, it's kind of the same story for me because I'm from Narragansett, so couldn't go wrong with URI.
Absolutely.
So what is your current title, your current employer, and then what other degrees or certifications do you have?
My current role is a clinical pharmacy specialist in cardiology at the VA in Nashville, Tennessee, which is the Tennessee Valley healthcare system. And I am double board certified in pharmacotherapy as well as cardiology pharmacy. And my role is to really optimize medication therapy for patients with cardiovascular disease, as well as to train pharmacy residents.
Awesome. Yeah. Dr. Estes said you're the residency program director there, right?
Yes, for the PGY2 in cardiology.
Okay. That must be a lot of work.
It is a lot of work. I sort of happened into it when the former program director took another position. I was asked to step into that role, and it's been definitely challenging, but really something that's very rewarding for me.
Yeah, that's awesome. So you completed residency training. Where was that for you?
Yeah, so I completed my residency training. My PGY1 Pharmacy Residency was actually here in Nashville, Tennessee, at the VA here. And then I did my PGY2 Cardiology Pharmacy Residency at the VA in West Palm Beach, Florida.
Very nice. And what was that experience like for you? Do you feel like you grew from student to pharmacist? I feel like that's a good time to, a good transition time.
Absolutely. Residency was definitely a time of growth for me personally and professionally. They say residency, 1 year of residency training is like 3 years of practice because you're fitting so much experience into that time frame. So it was also the first time that I had moved away from home. I grew up in Rhode Island. I had lived there my whole life. And this, to me was an opportunity to go somewhere new for a year and see what that would be like. And if I hated it, I could always move back. But instead I moved farther away and then made my way back here to Middle Tennessee, and I'm loving it.
That's great. I know I'm kind of in the same boat right now. I'm planning to move to South Carolina next year with my fiance now. So
Congrats.
Thank you. So yeah, really exciting, but I've been in Rhode Island my whole life. So kind of scary to make such a big change, but I think it's definitely good for us to grow in that way. So
yeah, I remember distinctly when I first moved to Nashville after graduating, and it was before my residency had started. I had just moved into my apartment. I didn't know anyone here, and it was actually Dr. Estes from URI that I called, and I was like, what have I done? Why did I move so far away? And she helped me recognize that soon you're going to be so busy, you're not going to have time to think about it, and you're going to grow so much from it. And she was right. And now whenever I interact with some of URI pharmacy students and they're preparing for residency, I share some of the advice that she gave me at the time, and it really has come full circle for me.
She's so great. I'm probably going to be calling her too.
I still do. She came to my wedding.
Oh, that's so nice. I love that. So you work at the VA. What does a typical day look like for you at work?
Yeah, so in the morning, I cover the inpatient cardiology consult service, which is a team service that covers any admitted patient in our hospital with cardiovascular disease that they're there for acutely. So my role is to identify how we can optimize their medications, whether that's any safety concerns and interactions, or if there's certain agents that have better data to support them in the specific situation. A lot of times on the complex patients, it's figuring out where in the evidence is the gray area that fits most accurately, because often we run into situations that don't fit perfectly with the evidence that we have. So I feel like that's something that URI also trained us really well to understand drug information beyond just the facts that are presented to us. And that has been a huge asset to me. After I round in the morning, I have my outpatient cardiology pharmacotherapy clinic, which is when I see patients independently. I have a scope of practice with the VA, so I'm authorized to prescribe within a certain scope of cardiovascular medications. And I'm supervised by a physician, but he's not standing over me, doesn't need to approve every decision. So I get to prescribe and optimize medication. So that's disease states like patients with heart failure, uncontrolled high blood pressure, high cholesterol, patients who've had heart attacks or strokes. And I'm working with them to get them on the best medication regimen to help them live longer, reduce the risk of those events happening again, which is really, really rewarding. And then a lot of times later on in the day, I have committees that I'm on. I'm on the medication use evaluation committee at the VA, which is really rewarding because we get to evaluate and make sure that on a whole, as an institution, we're using medications safely and effectively. And then I do a lot of residency training and precepting. So I oversee the residents, do topic discussions with them, get to kind of pass that forward.
Wow, that's awesome. I know. I feel like VAs are so cool because they have like their own protocols with a lot of things. So I feel like you do have a lot of opportunities for, prescribing, like you said. So I think that's really, really interesting for prospective students who are going to be watching this to know that that's an opportunity eventually. So,
and that's something that is really the future of pharmacy practice, and in terms of clinical pharmacy practice. The VA has been at the forefront of pharmacists having a scope of practice. There's certain states that have laws that are really progressive, but the VA healthcare system, being a federal system, doesn't have to kind of hold to those state lines that other pharmacists are kind of held to. So there's certain aspects where you have to be familiar with more pharmacy laws, because I'm not licensed in Tennessee, but that's where I practice. So that makes things a little interesting, but the scope of practice and the future of collaborative practice agreements and things like that is really exciting for pharmacy.
Yeah, definitely. It's so cool to, hear about all these. I've been doing a lot of these interviews. This is my last one, obviously, but it's just so interesting to hear about different different pharmacists in different settings and how your day differs from person to person. So
Absolutely.
So you kind of touched on this already, but what do you feel like is the most rewarding part about your job?
So I think there's two things. The relationships with my patients is probably the number one thing that keeps me coming back to work every day, that knowing that I can make a difference in those patients' lives. And when at the end of the day, we've got their meds optimized and they get to graduate from my clinic, and we say, how do you feel? And they feel better with the medications. And sometimes I think for me, the ones that are most rewarding are the ones who are skeptical of medications to begin with, but we talk about each one, talk about the risks and the benefits, and help them feel comfortable with it before we press forward. The other thing that's really rewarding about my job is training residents and getting to pay that forward and help the next generation of pharmacists coming up to see the passion that I have for clinical pharmacy, especially cardiology pharmacy, and share that with them. So even if they don't plan on going into cardiology pharmacy, there's things from that I can share with them and they can take with them. So it's things that I got from my professors at URI, from preceptors I've had on APPE rotations, as well as in my residency, and being able to share that with other residents.
So this is a question that isn't on the list, but I'm just curious. Did you know going through school that you were interested in this area, like cardiology, or did you just kind of like grow into that role?
I really didn't know in school that this is what I wanted to do. Really, when I decided to apply to pharmacy school, all I knew of pharmacists was retail pharmacy, community pharmacy. And my whole family thought, you're such a people person, you should be with people, interacting with people. And I liked science and healthcare. And so that seemed like a great fit. But during pharmacy school, that's when I learned about all these opportunities. And I think the moment that I realized that like clinical pharmacy was really for me was actually on my APPE rotations with Ann Hume. So I did 2 blocks with her, internal medicine and ambulatory care. And that was really a time for me that I recognized what I could do with my degree. And that really springboarded me into residency training and going after it. I knew that I liked cardiology during school. And then actually, my grandfather struggled with heart failure when I was in pharmacy school. And some of my professors actually were nice enough to give me feedback when I was looking at his regimen and, coming up with what we ought to recommend and think about for him. And so that was really my first taste of actually making a difference in somebody's care. And the professors at URI really supported me with that. Dr. Estes was always my go-to person saying, can you look at this before I send it to my grandpa's doctor? And so that's what really sparked my passion for heart failure. And then just in residency, it grew from there.
Yeah, that's great. That's absolutely awesome. My friend actually just started her first day with Dr. Hume's rotation.
Oh, I love her.
So, yeah, she's excited for that. And yeah, that's awesome. Such a personal story that probably just made you, more excited about heart failure in general, but cardiology, I guess.
Yeah.
So how do you feel like URI prepared you for this role?
So I think URI prepared me for my career in a few different ways. First, I mentioned earlier that there's a great value for the money that you spend. So the fact that I was set up financially and ready to be able to do residency was really important to me, because there is quite a pay cut to do a couple years of residency as compared to what you could make if you just went straight into a job. So I think that aspect was really beneficial for me. But also, I think the integrated coursework at URI, I don't know if y'all still call it core, but where you have your medicinal chemistry, your pathophysiology, as well as your pharmacotherapy all integrated together. It's really easy to forget things like med chem if you're not using them on a regular basis or knowing how they fit into the disease state. So the fact that we had those integrated allowed me to maintain that foundation and have that understanding of what's really going on in the disease states, while even when the science is advancing, I can learn more and build on that foundation. It's not some information that's totally gone and disappeared from my brain because they were separated. So the fact that it's taught integrated was really beneficial for me. And then the other aspect from URI that I had no idea at the time how important it was going to be in practice, but the drug information class is one that I use every single day, no matter what comes at me, whether I'm working on the medication use evaluation committee or I'm practicing in those gray areas where it doesn't fit the literature perfectly, or even when it does fit the literature perfectly, knowing how to apply it. So those skills, I think, were ones that challenged us, and I'm so grateful for having that understanding at a deeper level of the drug information, how to use and analyze the information we have.
Yeah, definitely. I feel like a lot of people say that, a lot of alumni say that after that. Dial is just such an important class, and I almost wish I could take it again now that I'm I'm at the end of rotations and I kind of understand things better. I feel like, which I think that they're making the curriculum different currently, so they changed it up a little bit. I'm not really sure how. I just know that it builds, so they start
Right.
with Dial and law, but it kind of they're taking it throughout their semesters, starting with P1 year, so you get little bits and pieces of it throughout your professional years, which I think is a good idea, because then you don't miss out.
Yeah, getting it up front, you have no idea how important it's going to be.
Right, exactly. I just kind of took the class and I was like, all right, but
yeah, it's not the most, it's not a class that's going to get you excited to get out of bed in the morning, but it's a class where you learn how to take in all the new information that's going to come out throughout the rest of your career. Even I've been out of school since 2013, and some of the classes of drugs we use now, I think of SGLT2 inhibitors especially come to mind. Like that wasn't even a thought in anybody's brain, maybe somebody's brain, but not anybody that we were talking to when I was in pharmacy school. And now it's an everyday occurrence in numerous different disease states that's really changing the face of medicine in some ways. So the ability to understand that literature and delve into it, look at subgroup analyses and post hoc analyses of those studies and meta-analyses, I know what all of that means and how to weigh it in terms of importance.
Yeah, definitely a valuable class that I honestly wish I could take again, because
I was really lucky. I had Dr. Ward for one of my APPEs, so I did a drug information one, so I felt like I got the like bookends.
Yeah, that's so true. You probably like got the intro and then, you know, came together when you were on